সামাজিক দায়বদ্ধতা থেকে নির্মিত জহুর গ্রুপের KPJ হেলথ কেয়ার সেন্টার। কুয়ালালামপুর বিমানবন্দর থেকে গাড়িতে মাত্র 10 মিনিটের পথ। এখানে মেডিকেল স্পেশালিস্ট রয়েছে 860 জন। নার্স, প্যারামেডিক, ফার্মাসিউটিক্যালস বিভাগ, টেকনিশিয়ান ও ব্যবস্থাপনা বিভাগে রয়েছে 8,992 জন। রোগীর আগমনে অভ্যর্থনা কেন্দ্র জেনে নেয় প্রয়োজনটুকু। বিদেশ থেকে আসা রোগীদের জন্য রয়েছে বিশেষ ব্যবস্থা। তারা আমাদের কাছে বিশেষ গুরুত্বপূর্ণ মানুষ হিসেবে তালিকাভুক্ত হয়ে থাকেন। আপনি এসে দেখুন, আমাদের অভ্যর্থনা আপনার ভালো না লেগে পারে না।
This center is one of its kind. Maybe I can consider it as maybe the first center in Malaysia or maybe in Southeast Asia. So why we call it a center? Because we give a complete services of weight management, from medical weight management to the surgical one. It is a new method of surgery which has been done recently by many surgeons all over the world. It is a laparoscopic surgical management. That's why with this laparoscopic surgery, or in other words, it is a keyhole surgery. Patient has less pain, less complications after the operation, and they can go home early. So that's why this surgery for obesity, which is done by this laparoscopic means, become more popular compared to before. Obesity surgery has been done a long time ago with the open method, but give lots of complication and even death. So now with this new so-called, if you want to call it cutting edge, with this new minimal invasive or keyhole surgery approach, the complication is less, and the patient can start his or her activity early. They can be discharged home after 3 or 4 days after the operation. The criteria for surgery is actually, if it is in Europe or America, their weight has to be enormous. We are talking about the BMI. The benchmark is the BMI. If the BMI more than 40, and they have some comorbidities, this we are talking about Europe and America, then they will be suggested for surgery. But for Asian people, BMI of 38 is considered severely obese, and if they have comorbidities like hypertension, diabetes, hypercholesterolemia, and other things, that is even more or even stronger to suggest them for surgery.
মেদবহুল রোগীদের জন্য আমাদের রয়েছে বিশেষ স্বাস্থ্যসেবা। সার্জারির মাধ্যমে প্রায় 100 কেজি পর্যন্ত ওজন কমানোর রেকর্ড আমাদের রয়েছে।
I came to Dhammacara specialist basically because after doing a lot of survey internationally on where best I could do this surgery, I decided to come and do it here because they had the best facilities and experience to do this. Before surgery, I was diabetic, hypertensive, I had neuropathy, I had arthritis. Other than the fact that I was overweight and heavy strain on my knees, I even had sleep apnea. Now, after surgery, all these things are gone, and they have left me 6 months after my surgery. I don't have any of these problems anymore. So I feel much healthier, feel very much younger, and have actually, in my own judgment, saved more than 10 to 15 years of my life.
As a dietitian, working with the bariatric team, we actually have to see the patient before the surgery, after they have done the surgery, and also few follow-ups after their surgery. It's a lifelong process. And usually before surgery, when we see them, we have to assess their dietary intake, and also at the same time, we have to advise them on healthy eating and also low-calorie diet. And right before surgery, they will need to go on a liquid diet. After surgery in the wards, we have to see them every day so that they will know what to do and what to eat after surgery for their recovery process. Even after they have discharged home, we will have follow-ups like almost monthly or 3 monthly. Then we have to see them also besides seeing the consultants. As for foreign patients, when they go back to their home country, we still do follow-up with them through email or by calling them.
সাধারণ চেকআপ থেকে শুরু করে বিশেষভাবে রোগ নির্ণয়ে কেপিজে হাসপাতালে রয়েছে আধুনিক ডায়াগনস্টিক সেন্টার ও ল্যাবরেটরি। রয়েছে রক্ত পরীক্ষা ও ইসিজির ব্যবস্থা। সেরাদের তালিকায় ইতোমধ্যেই এই হাসপাতাল নিবন্ধিত। 2011 সালে 24 লক্ষ রোগীর চিকিৎসা দেওয়ার গৌরব রয়েছে হাসপাতালটির। রয়েছে ডিজিটাল এন্ডোস্কোপি ও ডিজিটাল এক্স-রে ব্যবস্থা, সিটি স্ক্যান, রেডিওগ্রাফি আর রেডিওলজির ব্যবস্থা, যার সবকিছুই পৃথিবীর সবচেয়ে আধুনিক যন্ত্রপাতির সহায়তায় করা হয়। হাসপাতালের চিকিৎসা খরচও সাধ্যের মধ্যেই। ভারত, পাকিস্তান, থাইল্যান্ড বা সিঙ্গাপুরের চেয়ে চিকিৎসা খরচ এখানে কম আর চিকিৎসা সেবার মান উন্নত। তাই বিশ্বের বিভিন্ন দেশ থেকে চিকিৎসা নিতে এখন মালয়েশিয়া আসছেন রোগীরা।
I'm an anesthesiologist and intensivist, so my role is to assess patients preoperatively and prepare them before surgery. And after the surgery, I have to take care of them in terms of the pain relief, fluid balance, until they get out, they are discharged from the hospital. Patients who come for bariatric surgery are special. They're different from ordinary patients who come from other surgeries. Number one, the size is different. They are much bigger than the ordinary patients.
Number two, normally they come with comorbidities. They have pre-existing medical conditions. They have high blood pressure, they have heart conditions, they have diabetes, they have joint problems and whatnot. So they are special. We have to really take care of them in a different manner than we do with other ordinary patients. And on top of that, the management during surgery as well is different. There are many things to monitor during surgery to make sure they are okay, they are all right during surgery and after surgery. So we want patients who come to us to go home as though they do not have any illnesses, because they basically they are not sick when they come to hospital for this kind of surgery. So we would like to see them back home in their earlier conditions. They are healthy and well.
হৃদরোগের বিশেষ ও উন্নত চিকিৎসা ব্যবস্থা কেপিজে হাসপাতালের একটি উল্লেখযোগ্য সেবা।
And I'm by training I'm actually a laparoscopic colorectal surgeon, and I do mostly laparoscopic surgery and in the area of the colon as well as the rectum. We have a dedicated center which is the Advanced Laparoscopic Surgical Center and Weight Management Center upstairs on the 5th floor, catered towards patients who are undergoing this kind of surgery. And this center is not just managed by the surgeons, it is also part of the team comprised of the anaesthetists, the gastroenterologists, the clinical psychologists, dietitian, laparoscopic nurses, and various other fields. And therefore this, I would say that this is the only center which is specifically catered towards this particular type of surgery and particular type of patients. We have our own team to perform the surgery, which includes the nurses who are trained in laparoscopic bariatric surgery. Specifically for the Bangladeshis who are interested in having the surgery done in Malaysia, I would say that first of all, Damansara Specialist Hospital has, again, I would like to reiterate the point that we have a dedicated unit to cater for this particular group of patients. We are also from a Muslim country, which I would think would be compatible in terms of your expectations, in terms of food and in terms of facilities to do your prayers. And we understand, we share a similar kind of culture, and we do understand your needs from a personal as well as from a medical perspective.
হৃদরোগের সার্জারির জন্য এখানে রয়েছে সবচেয়ে আধুনিক অপারেশন থিয়েটার। এই রুমটাকে পৃথিবীর সবচেয়ে আধুনিক মানের কার্ডিওলজি সার্জারির অপারেশন থিয়েটার বললে ভুল হবে না।
to the patients. All the patients that are coming for surgery, they will have to come to me and I will do the assessment. Because as you know, it's important for a patient who goes for the surgery, because this is a major surgery. So we want to make sure that patient is ready for the surgery and then is really emotionally stable. So that is my role. My role is to make sure and see whether the patient will have no problems after surgery. That means because we do have some patients who, after going through the surgery, they have some difficulty and all that. So it's better to clear or screen them before the surgery. So that's actually our role, a clinical psychologist. We have to make sure that the patient is actually fit for surgery and then with no other problem, so that there is no problem after the surgery. My assessment, a psychological assessment, we use a standardized questionnaire where we evaluate the patient and see whether the patient is suitable for surgery or not. It's very important actually. Afterwards, when you talk to the surgeon actually agrees. And in fact, if you look at most of the established centers, the psychologist is he plays an important role in the team. And so far, from what I know, this is the only center in this country that has a whole team together. We work as a team.
বাচ্চা বা শিশুদের আনন্দ বিনোদনের বিশেষ ব্যবস্থা রয়েছে এই হাসপাতালে। শিশু রোগের জন্য রয়েছে বিশেষ সুইট, যেখানে শিশুরা থাকতে পারবে পরিবারের সদস্যদের সাথে।
KPJ Damansara Specialist Hospital is one of KPJ Healthcare Berhad's blood network of hospitals. KPJ Healthcare has 21 hospitals all over Malaysia and 2 hospitals in Indonesia. I am the CEO of KPJ Damansara Specialist Hospital, which was established in 1997. The vision of our hospital is care for life, while our mission is deliver quality healthcare services. Our centers of excellence ranges from the cardiac services, cancer services, and weight management services. We also provide state-of-the-art facilities, from the diagnostic imaging services right up to endoscopy services. In addition to our local customers, we also receive patients from abroad. And they come from Indonesia, from the United Kingdom, from Korea, from Bangladesh, and some also come from as far as the United States of America. Our hospital is accredited by the Malaysian Society of Quality in Health, which is also accredited by the International Society of Quality in Health, or ISQA. As one of the biggest private hospitals in Malaysia, we encourage people of Bangladesh to come to Malaysia and use the healthcare system of our country. The facilities that we provide are up to the mark as compared to worldwide standards. We are ready to receive you and be of assistance to all the people of Bangladesh when you need our services.
মালয়েশিয়া হেলথ কেয়ার ট্রাভেল কাউন্সিল MHTC আধুনিক ও উন্নত চিকিৎসা সেবা কম খরচে পেতে মালয়েশিয়ার স্বাস্থ্য মন্ত্রণালয়ের অধীনে গড়ে উঠেছে মালয়েশিয়া হেলথ কেয়ার ট্রাভেল কাউন্সিল MHTC।
Hello, I'm very happy to share with you about MHTC. MHTC is an organization which is under the Ministry of Health Malaysia. It's an initiative by the ministry, and we are an organization that develops and promotes medical tourism in Malaysia. We have been corporatized, and right now we are the main agency that promotes medical tourism. We are very happy to share with you that MHTC has got 63 hospitals registered with us, and these 63 hospitals, we promote these hospitals and the procedures and the treatments that they offer to Bangladesh, and we have done these few events in Bangladesh for the past 2 years, and we're very happy to inform the Bangladeshi public that from 2011 to 2012, we saw an increase of about 200% of Bangladeshis coming into Malaysia for treatment. And many of the Bangladeshis that have come to Malaysia are very happy with the treatment that they get in Malaysia, and they were very surprised to know that Malaysia has got such good hospitals that offer very high-end treatment and procedures in this country. And the prices is also very affordable, competitive, and very good outcomes. We offer high-quality care, and our doctors are trained in countries like the UK, US, and Australia. MHTC has now opened a representative office in Dhaka, and this representative office will MHTC rep office that we hope to have a local line whereby any Bangladeshis who wish to find out about Malaysia and what Malaysia hospitals can offer, they can actually call this local number and visit our rep office in Dhaka and find out more information. And we hope that through this office, we will also be bringing our consultants, our specialists on a weekly basis. Right now, we are starting every 2 weeks. We have a doctor coming from Malaysia to actually speak on the procedures that they do in Malaysia, the high-end procedures and treatment that is offered by the doctors in our hospitals. And we have seen a tremendous response from the Bangladeshi public, and they are very keen to know about Malaysia being a healthcare travel destination.
We have not only provided a wide range of care in all our hospitals, but we have hospitals which have centers of excellence. We have certain hospitals which focus on cancer, some hospitals focus on cardiac, there are some hospitals which focus on bone diseases, orthopedics, spine problems. So we have hospitals focusing on certain centers of excellence, which makes it easy for patients, whether from our own country or from abroad. They are able to go to these centers for the best care, for world-class care. I'm sure the patients from Bangladesh, irrespective of who they are, will feel most comfortable with Malaysia as a destination, a preferred destination for their healthcare needs. They will find that the country is friendly, that the environment is friendly. You'll find that the hospitals are very, very courteous to them and to their needs. And they will feel themselves most comfortable. And we are confident that we'll be able to deliver care which is sought after by irrespective of who they are and what their background is. So I would encourage those from Bangladesh and from the countries in the region to come to us to seek the type of care that they are looking for.